Welcome back. In this video, I will explain the PKT diet and the goals of PKT. What is Precision Ketogenic Therapy? PKT is a type of ketogenic diet prescribed to treat epilepsy. A ketogenic diet is low in carbohydrates and high in fat. PKT, though, is based on the individual person, using diet prescriptions and recipes that best fit that person. When on this diet, we record your child's food intake and number of seizures to track your child's progress. Our first objective at the University of Florida Precision Ketogenic Therapy program is to support the patient and family on PKT. Having a child with epilepsy can be stressful, and we want to make PKT as smooth as possible for you. We are here to help you as we have the same goals that you do. Another objective at the UF PKT clinic is to understand how to make PKT better for every patient. When compared to typical medication, PKT can be much more personalized to the individual. We want your child to eat things they enjoy, an amount they enjoy, and when they enjoy it. Our goal is to work with you on creating a PKT diet that works for you and your family. We are also continuously doing research on how to improve PKT. One of the main goals of PKT is to see a reduction of seizures. Just as with other treatment options, a change is not always immediate. We hope to, over time, both reduce the amount of seizures and improve the quality of the seizures. In some cases, we are able to completely eliminate seizures. Another goal of PKT is to improve alertness, cognition, and awareness in the patient. Depending on your child's level of alertness, it is possible that there is room for improvement. PKT often sees these type of improvements in patients. Not only this, PKT can also reduce or eliminate the need for anti-seizure medications. This can also help with alertness and create a happier, healthier child. When thinking about what PKT is, we must go back to the basic three building blocks of food that we discussed earlier: fat, protein, and carbohydrates. In PKT, food needs to be weighed precisely in order to make the therapy accurate and successful. The meals we prescribe will have ingredients listed with the appropriate weight of each in grams. This is to ensure that the correct ratio of protein, fat, and carbohydrate will be in each meal. On PKT, your child will have something called a ketogenic ratio. This is similar to the dose of a medication. Put simply, the ketogenic ratio is the grams of fat compared to grams of protein and carbohydrate combined. The ketogenic ratio can be thought of as the strength of a therapy. A higher ratio is a stronger therapy. Typically, a 4-to-1 ratio is the highest ratio used clinically. Ketogenic meals can sometimes look smaller than normal meals, but that does not mean that the right amount of calories is not being consumed. Fat has more calories per gram than protein and carbohydrate. A gram of fat has 9 calories, while a gram of carbohydrate has 4. This means that in 1 gram of fat, there is more energy than in 1 gram of carbohydrate. This means that in a 4.0 to 1 ratio, where there are 4 grams of fat to 1 gram of protein plus carbohydrate, 90% of calories come from fat, and 10% come from protein plus carbohydrate. Time to check your progress. True or false? A gram of carbohydrate and a gram of fat give you the same amount of energy, or calories. The correct answer is false. 1 gram of fat has 9 calories, while 1 gram of carbohydrate has 4 calories. In our next presentation, we will be talking about the typical diet versus the PKT diet.